Hi guys, once again, thank you for logging into my channel. As usual, I always tell you to subscribe more so that you can learn more about your health matters endocrine. So let's get started. So today our topic is palpate your balls. And the reason I decided for us to do this is because most of the time we tend to forget the boys. And because of that, you find that some of the topics tend to be unexplored. So today we look at testicular cancer, which is relatively common, constitutes around 1 to 2% of all male cancer diagnosis globally, and it's higher. The prevalence is higher in children and young adults around the age of 13 to 40 years. And if left untreated, can pose great health risks because of the risk of spread to different parts of the body. But most of the time, when caught early, the outcomes tend to be very good. And the main treatment, as we will see, is surgery. So you'll ask who is at higher risk, of testicular cancer. But before we look at that, let's just have a quick chat on the reproductive system. And what we mainly know is the penis, because that's what we see outside. Then we have this nice bag, which is called the scrotum. This is where the testes are stored. And then we have a small pipe here called the epididymis. The epididymis, most of the time, is what you will feel as a firm cord around the scrotal area. And this is where most of the stored semen would mix now later with the sperm count, then would come out through the seminal vesicles, then it will be released as an ejaculation. So the main thing, our focus here is on the testicle. So who is at risk? Anyone who's had a positive family history of cancer needs to worry, especially testicular cancer. Even you, if you've had your own history of testicular cancer, then you need to get yourself checked. History of what we call undescended testes. These are children who are born with the testicles are still inside the inguinal canal and have not taken their original space within the scrotum. So mothers, please remember, as you wash your babies, always just palpate the scrotum. Then anyone with any history of difficulty in fathering a child, then you also need to get yourself checked. Then inguinal hernias and undescended testes tend to be the same. Then if you have any genetic disorder that at times can interfere with fertility, what is called Down syndrome, then also your risk is higher. So the manifestations can either be localized within the testes or give us hormonal imbalance. Within the testes, most of the time, it is a painless lump. So it's not only women who need to palpate themselves for lumps, but now we've seen that, hey, also men really need to. So if you feel a painless lump, if you're having any pain within the testes that is not going away, or any heaviness within the groin. Most patients also at times just present with issues of hormone imbalance. If they're before puberty, then at times you might find if the tumors are secreting a lot of androgen or testosterone, then you find they develop rather quickly than they should. And this is where, the voice becomes deeper, the balding is more significant, the hair growth is more, the penis grows faster in length. Or in men who've already reached puberty, or men who've already passed their puberty stage, these are the adult males, then you find they might present now with more feminine symptoms. And here is abnormal breast growth, gynecomastia, or shrinkage of the testes, shrinkage of the penis, unusual growth of breasts, or at times even just their libido or their urge for sex really goes down. And also at times if they do a semen analysis, their sperm counts are already low, or they also have trouble, siring children. So as you move towards a diagnosis, remember, nothing beats a good physical exam from your doctor. So they'll always assess. So if you feel the lump, they'll always confirm that. They'll also do a good general exam just to see if there are other signs of feminization. But then they'll always send you for an ultrasound. And this is now our indirect view to be able to see the lump and then guide towards a diagnosis. If you had presented with hormonal symptoms, then we'll run a full hormonal profile. And that also usually guides us to know which cancer is it that you could have. But remember, no biopsy, no needle should be poked there to see what is this. So this is the one time we say no biopsy should be done. Then in the event that the doctor also suspects a cancer, or based on your symptoms you present with signs that could suggest an advanced disease, then they would also send you for scans for staging, which can range from a CT scan all the way to a PET scan. So the treatment will usually depend on the stage. If it is localized disease, surgery is key. So do not be afraid. I have patients who fear going under the knife, but don't be afraid. This is the one time I'm saying go for it. It is curative. If it is advanced disease, because remember, you will not manage you as the endocrinologist. We always work in a team. So depending on what our oncologist recommends, our surgeon, in this case, are usually urologists. There are times we work also with radiation oncologists. Then we will always advise which order comes first. But if it is localized, surgery first. If it is advanced, then usually we at times combine what we call debulking, which means you remove the tumor. And also there's additional treatment, which can either be chemotherapy or radiotherapy. Then this specimen is what is taken to the lab and usually guides us to know the type of cancer that you have. So the additional treatment will always depend on what you have. But remember, discuss future fertility if you want children with your endocrinologist. And this is where now we can harvest, sperm and store in sperm banks. Or if you've had desired family size, then we sort of go for it. So that I won't belabor you with this, but just based on the histology, at times you might find your doctor will talk about which type of cancer that you have based on the histology, but just to know that there are various types that could exist. So as an endocrinologist, again, you'll ask me, so what happens once I have one of my testicles or one of my bones removed? Some of the concerns that we see, as we have seen, is infertility, because most patients at times will even have low sperm count at the beginning. Issues with low testosterone, which is low libido, erectile dysfunction. Remember, a man without a working machine, they don't consider themselves men at all. So usually if we find that the testosterone is low, documented by blood tests, then at times we recommend testosterone replacement within reason. So don't go for it yourself. And also in patients with infertility, we usually can opt for assisted reproductive therapies. If you had preserved sperms, then that's where we go for either in vitro fertilization, intrauterine insemination, or at times, if worst comes to worst, adoption. But we can always discuss the options as we go along. Then, of course, low testosterone can lead to reduced low bone density, increased risk of fracture, osteoporosis. So at times we have to replace that as well. So the follow-up will depend on the cancer. Generally, we'll follow you up for 2 to 5 years, and usually it entails a physical exam, and usually scheduled ultrasounds, which can be done every 6 months, just to see is there a new mass coming up and all that, and of course blood tests to ensure that the hormonal profiles are there. So please, guys, don't always miss out on your doctor's appointments. But what can you do as the patient? So there are no screening programs like we have for the ladies, but this is where your skill comes in. So usually we have what is called monthly testicular self-examinations. I swear this is the secret, foolproof tested. This is how you can be able to tell if something is creeping up, and especially those who have a high risk of cancer, or if you've had a previous encounter or previous diagnosis of testicular cancer. This is how it's done. Best done once a month after a warm shower, so that the testes, the scrotum relaxes, then you're able to palpate. The more you do it, the more you'll be able to learn. But the secret is feel it. Initially, you might feel like things are lumpy, you're not sure what is what, but at least be able to feel the two testicles on both hands. Then just rub it around using your index and your middle finger. Then you feel the surface. Then you'll feel a little bit nodular, but that is normal. Then once you do that, then now focus on one testicle at a time. If you have had one testicle removed, then usually you also have to sort of feel the contralateral or even that space that was left in case anything new grows there. Then finally, you put both testicles on your palm and just feel how sort of they drag. If there's that painful dragging sensation, then that's the time to get concerned, because that is that sort of heavy feeling. So the more you do this, the more the more you'll be able to feel what is normal and what is abnormal. And then usually I say, if you feel anything, if you're concerned, if you're worried for whatever reason, always walk into my office. I've always shared it in the contacts below. So you walk in, then let me have a counter check, then I'll tell you if we always need sort of to panic. But please, let's teach ourselves to palpate our balls literally. So in summary, what are we saying? Testicular cancer might be rare, but we should still be aware about it and we should still be vigilant, because it's one of those cancers that early diagnosis, early treatment still remains key. And the symptoms can either be within the testis or hormonal. So if you just feel anything has changed, always better come and get it checked. But remember, self-examination remains the best tool in our hands. So once again, thank you guys. Always a pleasure. Remember to hit like, subscribe, so that you follow me for more tips, and see you next week. I have something exciting for you guys. Thank you.